demonstrate scrubbing, donning of gloves, as well as the way you've been drying if you've been given a sterile procedure. So I want to look at this procedure to be a very serious procedure, because most of the procedures that we do require us to scrub, dry, and don gloves. So sterile procedures, for example, you have been asked to do, say, suturing. So if you're doing wound suturing or suture removal, or if you're doing tracheostomy care, or if you're doing colostomy care, such procedures you need to scrub. Then there are procedures which you need also to don gloves. So we'll combine this session with 3 procedures. There are 2 types in which you can scrub. For this one, we're going to do the Osce way. But then there's another way in which we do it. For example, when you're in the ward, you even have the whole day to do the procedure. There's a way in which you need to scrub. But in this case, we're doing it for 5 minutes in terms of Osce. So Osce, you're required to scrub, and then the procedures where you also need to don gloves, and also it's automatic need to scrub and dry hands. So then there's a technique for also opening the sterile gloves. So there are gloves, when you read here, they would say tear to open. So tear to open. Then there are gloves where you need to peel. Okay? So there are those which need to peel. Peeling is like that, you peel. And then there are those which you need to tear. Okay? Peeling and tearing. So there are 2 types. So this one is tear. So I'm going to tear here. And then we open onto the sterile fluid. So then before you use the gloves, you need to at least verify the expiry date. The expiry date is 9/2021. So it's here. That's the expiry date. So meaning the gloves are okay and safe to use. So let's see now how you do it. So let's just open. So this one you're going to tear. So you need to tear there. Okay. Then after tearing this, you need to throw it away. Okay. So with us here, we have this sterile fluid. So on the sterile fluid, we have hand drying towel. So as you can see, this is hand towel, which is sterile. Then these are sterile gloves. So on the sterile fluid, we should drop our gloves. And then this has to go down in the receiver. Okay. So then from here, we need to come and scrub. So after, if we've prepared any procedure, meaning it's any procedure which is sterile, we need to have everything there and all that, but we just need to demonstrate how you scrub, dry hands, and don gloves. So those 3 techniques. So let's see. So then we need to open up the tap. So this is the Osce, remember? You need to open up the tap, and then the first thing that you need to do, you have to be quick. You have to go in like that, then like that, and come out. Do you see? Wet your hands like that. Then again, go like that, come out like that. So your arms are wet. Then you get your sock, and then make a quick lather, and just lock there. When you lock there, don't waste time. Come and do that up to your elbows again. Then from there up to your elbows. Then go back on the tap and pass it on like that. It has to be quick because you only have 5 minutes to perform your sterile procedure. Then after doing that, then my assistant can close the tap for me. That I have to come to the sterile fluid. So this is the sterile fluid. I don't need to touch. So I have to get the hand towel. So as I get the hand towel, it's up to grab it by the corner there and bring it out. So then there's a technique, because we have how many corners? 4 corners. Let me just touch this side so that you see the corners. We have 4 corners. So there's 1, 2, then 3, 4 down there. Okay. So these corners have to be utilized effectively. Okay, so the effective use of these corners will be, you start with corner 1 like that. Okay, corner 1 has to be in your palms. Okay, corner 1 in your palms, you start from the tip there. Okay, the tips, then you come this side and then you go down like that up to here on your palm. That's corner 1. Then you go to corner 2. This is corner 2. Corner 2 has to be outside your palm like that, then your tips, and ensure that your hand is dry because you're going to don gloves. So that's corner 2. Then again, after your tips are done, you go round, and then when you reach there, you have to go all the way like that. Okay, until you reach your elbow. Then you need to go to corner 3. So this is corner 1, which you did, corner 2, then corner 3. So for corner 3, it has to go in your palm again. So it has to go your tips. Your tips again have to be dry. Tips. Then after your tips are dry, now you go all palm like that. Then after that, you shift to corner 4. Corner 4 is this one. So corner 4 has to go outside your palm like that. Your tips, then you go round like that. Okay, up to your elbow. Okay, then after you're done with this, then you need to throw it. Usually we put a ball there so that you receive the drape. Okay, so that's the technique for drying of hands. Then we move on to another technique, which are going to don gloves. So these are not just gloves but sterile gloves for doing sterile procedure. So let's go to donning of gloves. So as you can see, you need to flip, okay, and then turn like that. Then we need to go there and open. Okay, after opening, then you need to identify which side you're going to start. As you can see, the gloves are folded. Since they are folded, I'm not going to touch that part, but I'm going to touch the inside part of the glove. So not that part, but inside of the glove like this. But not that part which will be used for working. So this part will be used for working, but then this part will be inside. So I need to go inside like that. Okay? And then if it remains there, leave it, but then you need to just touch inside. Okay? Like that. So no need of touching here. Don't touch here with your bare hands. Then this part which is gloved has to go inside like that. It has to go inside. Did you see? So it goes inside and then allows my fingers to go like that. Okay, then I can control this part. Okay, then again, no need of touching where the skin was touching, so then I can do that, and then meaning my gloves are done. So at least right now I've done the gloving, so I can go ahead with the procedure. Then when moving this paper again, you go in the middle like that and grab it like this, and then throw it down there. Okay, no need of going to put like this because you'll be doing a sterile procedure. So just need to throw, or if you miss, let it be there. Okay, if you've got an assistant, you can ask your assistant to pull the receiver nicely so that you pour. So here now you are ready to do the procedure. So like this you can carry on. I'm sure the 3 techniques that you have demonstrated today, you'll be able to apply. So we did a quick scrubbing, then also did the technique for hand drying, then donning of gloves. So those 3 procedures in one are very, very important. Keep practicing, and thank you very much. We'll see you in the next episode. Thank you.